The title of this section, or this unit, is HIPAA Security Rule and Overview. The unit objectives for this unit are to describe the scope of the HIPAA Security Rule, to understand the threats and attacks to which a healthcare enterprise are vulnerable, to define key security terminology, concepts, and categories, to describe administrative safeguards implementation and specifications, to describe physical safeguards implementation specifications, to explain technical safeguards implementation specifications, to describe organizational requirements, and finally to describe the policies, procedures, and standards as well as the documentation standards that are included in the HIPAA Security Rule. Next slide. The first topic, or topic A, is the scope of the HIPAA Security Rule. Next slide. Now, one of the things to talk about is in the security rule there are standards, and if there is a standard, that standard must be adhered to at all times. That's something that has to be implemented. It is required of the rule. Underneath a number of the standards are what are called implementation specifications, and there are two types. One is required, you have to do it, and the other is called an addressable implementation specification. Now, an addressable implementation specification is not optional. There are things that need to be done to comply with the security rule. One of them is you implement it. Just as the rule states, you implement the implementation specification as it is written in the rule. Another is you implement something that's an alternative to that specification but provides the same level of security as that implementation specification. Could be a combination of the two, where in some areas you implement exactly the way the rule is stated, or in other cases you'll use some other form of technology or process that will provide equal security. Now, what you also have the option of doing is not implementing an addressable implementation specification or alternative security measure, but the covered entity must still meet the standard that is identified in the security rule. They also need to document how the standard is being met. They also need to document the decision not to implement and the rationale behind not implementing that implementation specification. And cost cannot be the sole reason for not adopting an implementation specification. One thing to note is to periodically go back and look at the security rule, and if there was a decision made at one point in time not to adopt an addressable implementation specification, times change, technology changes. A very good example of that is when the security rule was published in the Federal Register in 2003, encryption was an addressable implementation specification. Not that long ago, the Center for Medicare and Medicaid Services announced that encryption is mandatory. It is no longer considered addressable because the cost of the technology has come down. There are not issues with interoperability that existed in 2003. It is considered a mature technology. And as an example, if I'm a small clinic, it's accessible. It's within my budget to acquire secure messaging for my staff, and those prices would range all the way from, say, $100 a user all the way up to a very large organization that may spend several $100,000 on some form of secure messaging solution. So at this point in time, what was an addressable implementation specification, because of changing times, technology, and so forth, now becomes a required specification, primarily because organizations cannot truly justify not implementing that addressable implementation specification. Next slide. Now, the standards that are included in the HIPAA security rule were designed to be comprehensive. They included such things as identification, authentication, access control, accountability and non-repudiation, integrity, communications, administration, and so forth. So it was very broad, and the intent was to cover the spectrum of security, not so much in the sense that it was specific to healthcare, but looking at security in general, because security is applicable across many industries, and many of the concepts around security are the same no matter the industry. So the idea was to look at what are the best practices as were embodied in the NIST guidelines as well as ISO standards, and create a rule that was scalable and could be followed by healthcare organizations in order to implement comprehensive controls to help protect protected health information of patients. It was technology neutral. It did not require the purchase of any specific type of technology, say a particular firewall or particular encryption device. It, in essence, looked at it from a perspective of this organization is going to determine what is reasonable in the area of technology based on the size of that organization and the complexity of that organization. So, and therefore it made it very flexible and scalable, because it was intended to work for the single provider office all the way up to the multi-state health plan or even the larger business associates. So it was then intended to work in a very simple environment and also a very large or very complex environment. Next slide.